Potassium is the major intracellular cation in the body, and it's important for cardiac function and neuromuscular transmission. So 98% of potassium is present intracellularly. Let's say ICS, intracellular space, ECS, extracellular space. And 2% potassium is extracellularly. Concentration of potassium here around 130 to 140 milliequivalent per liter, and here 3.5 to 5 milliequivalent per liter. So you see it's very tiny amount of potassium extracellularly, but very important to keep it in that range to maintain a proper cardiac function and neuromuscular transmissions. So any small shift in each direction can significantly affect the extracellular space potassium concentration. So the main thing that keeping the potassium intracellularly and sodium extracellularly is this pump, the sodium potassium ATPase. So basically it's pump sodium out and potassium in, 2 potassium in, and 3 sodium out. So anything that inhibit this pump will lead to potassium remaining extracellularly, right? Shifting of potassium to the extracellular space, and anything that potentiate or augment or increase the function of this pump, that will lead to shift of the potassium to the intracellular space. So even with normal total body potassium, the extracellular potassium concentration can change significantly with any shift. So it's very important to know or to be familiar with the factors that affect this shift. So this is the intracellular space, extracellular space, and this is the sodium potassium ATPase pump. Anything will enhance the function of this pump will lead to the shift of potassium intracellularly. And big example of this is beta-2 adrenergic stimulation, receptor stimulation. It will augment this pump and push potassium this direction. Let's put it in a blue color. So this will push potassium this direction. So blocking these receptors, if you block them with beta blocker, that can lead to the opposite, but the effect is less significant. So whatever we mention here, the opposite of that will cause an opposite shift. The second thing is insulin, and insulin shift the potassium same direction into the cells. Not necessarily it has a direct action on this pump though. So insulin deficiency can cause the opposite, right? How about metabolic acidosis? Metabolic acidosis, I'm going to put it here. With metabolic acidosis, we're producing hydrogen ions, right? And producing hydrogen ions, some of these or a lot of these hydrogen ions has to move to the intracellular space to be buffered intracellularly. So it's not everything buffered by bicarb. Some of it has to be moved intracellularly to be buffered by the intracellular anions. That will create a negative potential here. Will have more negative charges, right? To balance these negative charges, potassium will be shifted this direction. Let's use a green color. So metabolic acidosis will cause a shift of potassium from the intracellular space to the extracellular space. Technically, you can say metabolic alkalosis will do the opposite, right? Metabolic alkalosis will shift the potassium intracellularly. Digoxin, as you know, inhibit this pump, shift potassium this direction. Also, alpha adrenergic receptors stimulation can inhibit this pump as well and lead to shift of potassium out of the cells. So the green one cause hyperkalemia and the blue one cause hypokalemia. Also, increase in the tonicity here. If the extracellular space tonicity become really high here, the tonicity of extracellular space, that will drag water to the side, right? And when you drag water to this side, this potassium concentration in the intracellular space will increase. That will lead to movement of potassium down the gradient and shift the potassium from intracellularly to extracellular space. So the main one, and as I said, if you kind of reverse these conditions, will shift the potassium to the opposite side. So beta-2 receptor stimulation, insulin will lead to shift from outside to inside. Metabolic alkalosis will do that, right? Alpha adrenergic receptors blocker will do that. While on this side, metabolic acidosis, digoxin toxicity, alpha adrenergic receptor stimulation, tonicity effect. This pump, any medication that block this pump will lead to shift of potassium from the intracellular to the extracellular. And any medications or hormone that will potentiate or increase the activity of this pump will lead to movement or shift of potassium from the extracellular space to the intracellular space. Now, where does the body get potassium from, or sources of potassium, and how the body regulate that? So potassium, of course, we get it from food, the intake of potassium, right? Medications, some medication has potassium, blood transfusion, and blood transfusion, GI hemorrhage, GI bleed, because the body reabsorb while the blood traveling through the GI tract. Some of that blood gets reabsorbed, and that could be a source of potassium. Some like from nutrition or IV fluid, or nutrition like TPN, that can give you some potassium as well. And hemolysis, rhabdomyolysis, hemolysis. So all these are sources of potassium. But the body is so efficient to keep the potassium, the extracellular fluid potassium concentration at 3.5 to 5 milliequivalent per liter. So how the body does that? These are the sources, the the input of potassium. How is the output of potassium? We lose potassium in the body through 3 pathways. First is kidney, which is the main organ to regulate potassium. And in order to have problem with potassium, most likely you do have a problem with the kidney. 2, stool through our gut, and 3, through our sweat. The main organ that regulates potassium is really the kidney. So whenever you see somebody with a hypo or hyperkalemia, suspect they're having issue with the kidney in a way or another. The kidney is so efficient in preserving potassium when we have low potassium stores, and in getting rid of potassium when we have excess potassium. Around 10% through the stool, and even less through the sweats. So it's very important to understand how the kidney works to preserve our potassium. With the stool, I have just to say that knowing this, you should understand now if you have diarrhea from any cause that can make you lose potassium. So we sometimes forget that diarrhea is one of the main reasons for hypokalemia. The sweat has to be really excessive, very excessive sweat, not just the regular sweats that can lead to significant potassium depletion and hypokalemia. And remember these 2 things, when we come to the treatment, you will find one of the treatment we use is something that will prevent potassium absorption in the body, in the gut, and something that lead to diarrhea, and we'll come to that. But now let's focus on the kidney. How the kidney regulate our potassium is very important to understand, and this is what I'm going to explain next video.